Hello, everyone. Hopefully we're online and live. Matt, we good to go? Good? Okay, so we're really excited about this, our testimonial interview today. We're here with Coach John Gramuglia, that's National Hall of Fame wrestling coach, Coach G. We were talking about this, Ohio Hall of Fame coach, Coach G. Medina County Hall of Fame, John Carroll. What else? Trinity,
Yeah.
Trinity Hall of Fame. Any others?
I can't remember.
But we're really honored to have Coach G as a patient and for him to trust us. And so what we wanted to talk about, he's had some sports injury type issues. Your dad, right? Yeah. So he's had some dad injuries, we like to call them, but also some athletic injuries that have kind of maybe started to catch up a little bit
Yes, I'm getting a little older there.
as we get older. So anyway, first of all, thanks for being here with us.
Thank you for having me. I'm excited to be healthy again.
Right? So how did you first, well, we have a good friendship history going back a long time, but how did you first got here years ago?
Yeah, probably about 10 years ago, right?
Yeah, over 10 years, because
Yeah.
the wrestling state
Yeah,
championship.
yeah, so it's been probably 12 years
Yeah.
or so.
And how'd you get here the first time?
Bobby Jones, who I was teaching and coaching with,
Yeah.
I was all messed up, injury in a weight room, just
Yeah.
overdoing it, and I had all these doctors telling me that to do this, do that, have surgeries, and Bobby was like, go to Bups.
Yeah.
He'll fix you up. And you did.
Right.
You know, so
So that was a while ago, and then
that was at the old place.
Yeah, that was at the old place in the corner. So then more recently, you were back in with what was the most significant problem?
My neck, C5, C6, is just kind of injured from wear and tear, and I just kept getting shoulder injuries, neck, couldn't sleep. That's probably the biggest thing.
Right.
And from the onset, even from the first treatment, I could at least get a couple hours.
Right.
So.
And it was so neck pain down your arm.
Yeah. Both. I've had it on both sides. It just goes back and forth. Right side numb, left side numb.
Bad disc.
Bad disc, and
that one they still tell you that you need surgery.
yeah, they still stay, but they can't guarantee anything.
Right.
They said, well, you could still have all these onsets. So I'm like, I'm not going to go through the front and the back and have any surgeries like that, because you've told me we can heal it.
Right.
Without that, and
Good
here I
deal.
am.
Right.
You know, I'm sleeping again, and
Yeah.
I just have to be smarter when I'm taking my bike down. That happened last summer. Remember,
Right.
I take my bike off the rack and it fell on me.
Yeah. Well, I mean, you're still pretty active. I watch you coach wrestling, and you're sweating and you're wrestling with kids and pulling people around and all kinds of stuff. And I kind of watch it and I go, oh, don't you know what your neck looks like? But you've been feeling pretty good.
Yes.
So I wanted to talk about, or you talk about, some of the things that we've been doing with you. So there's two main things. So one, we get adjusted and we do chiropractic to help the joint move better. But Coach G's been using some of our special, more advanced technologies because he needs it. And so we've been doing some sports massage. You want to talk about that?
Oh, wonderful. Well, Maddie did a couple massages too and gave me some stretches that I do.
Right.
And do those, daily. I have to, or you can't function.
Right.
But the massage and the trigger point releases, and then the laser has just been, I just swear by that thing.
You feel a difference right away, right?
Yeah, I just had one probably, 5 minutes ago.
Yeah.
You could just feel the warmth, and it's kind of like an ultrasound, but in a higher technology,
Yeah.
deeper tissue.
Right.
It penetrates a little bit more, and it doesn't take long.
Right.
It's only a couple minutes. Not
Yeah, a
even.
few minutes.
So you don't have to sit there for 20 minutes with the ultrasound and go
Right.
around and around and around. So yeah, I swear by the laser.
You after you do it, you actually notice that it doesn't feel as
You can
painful.
feel actually when you can feel some of the trigger points release as you're doing it.
Yeah.
You get like a little twinge.
Yeah.
But yeah,
that's awesome.
And then I've had some athletes that have had that for their ankles.
Yeah.
Any ankle sprains or shoulder sprains.
Right.
You know.
We've taken care of several different.
Oh, lots.
Coach G's a different type of coach. He just would bring people over whenever they needed it.
I call it
Yeah.
instantly in practice. The one that separated his shoulder, right?
Yeah.
And he 2 days later was wrestling against Brecksville.
Yeah.
Which
doesn't
that's unheard
usually
of.
happen.
So
we used the laser and we did some of those different things. How about the we used the arthrostem, because the problem was with the neck, right? But then we found a lot of trigger points over in here.
I got the one right on the tricep, and then right in here.
So we did a lot of manual therapy and muscle work on those. You can feel that release as you're doing it. But remember when we started doing it, it was like really painful.
Oh my gosh.
And then as it gets better, right, it improves.
Oh yeah.
It doesn't.
There's no doubt.
Doesn't have as much pain there. I mean, actually, while we're working on it,
it releases right then, and you go home, you ice it, and then you get a reprieve.
Right.
You know. And
well, you had a little bit of an exacerbation here about 4 weeks ago or 6 weeks ago or something like that, maybe 4. And then the other thing that I wanted to talk, but now you said you had a good night last night, sleeping better.
Yes, totally slept through the night last night.
So
when that happens,
you're pretty happy.
Yeah, I mean, because it relieves your stress.
Right.
You know, if you can't sleep,
right,
and you get stressed, then you get tighter.
Right.
And so your whole body just in mental anguish is gone.
Right. So one other thing we got to give you credit for some other stuff. If you guys already know Coach G, you see he's looking really felt and fit lately. So you also changed your diet and have been doing some of those things too, right?
Yeah, I eliminated a lot of sugars, carbohydrates that were, fluff stuff that I really didn't need.
Right.
Gave up beer.
Right.
And lost about 30 pounds.
30 pounds.
I've had it off for 7 months now, so
yeah,
my weight has not fluctuated at all.
Right.
With the help of your wife giving me the diet, and my wife, actually cooking different too.
Right.
So it's kind of been a lifestyle now that our kids are gone.
Yeah.
We both so she's lost about 15 pounds.
That's awesome.
Yeah, so we both are healthier, more conscientious of not eating the bad foods.
Cool.
Yeah, we cheat every once in a while at a graduation party or something. Sure. Had some popcorn.
But that's a good point, because you're not always going to be 100% strict. But when you're in a better state, you can do some of those things, and it doesn't fluctuate your weight. Amber talks about that a lot too. And so, pretty much that was it. We just wanted to get your story, which is awesome.
Well, I'd like to thank you guys. Your staff is phenomenal. I just like how they treat you when they come here. They treat you like you're part of the family, and
cool.
I couldn't say enough about coming here. It's very relaxed, and talking with all your other patients, they feel the same way.
Thank you. Well, we wanted to kind of highlight this because there's some dads, some I just said old, some ex-athletes.
They need to come in.
Right, that have maybe been having some aches or pains that aren't sure what to do with it. You don't have to live in pain, right?
Never.
That's the main thing that we want people to know. There are technologies out there that can help make changes. And the other thing is for athletes that are competing still, junior high, college, high school, the more you take care of the body, the better your body's going to work for you. And so we're not just dealing with symptoms. Like a lot of times people will wait until they have a knee problem or a shoulder problem. But really what we're talking about is how can we optimize health and function while training, being able to put in the grueling, Coach G's practices were never easy. And I'm sure. So being able to do that without the body breaking down is how well you take care of it ahead of time.
And in recovering quicker. That's the big thing, that you want to be able to recover so you can keep having those workouts. And this is a good way to do it. I know a lot of our athletes have. And
right.
You can't perform at that great level. And I know, like all the NBA guys, they're getting all their treatments. That's why they have 3 days off right now between their games. Right.
It's high-level, advanced types of treatments, not the old stretching and ultrasound. Those things are kind of not out the door now.
But anyways, thanks for being here. We appreciate it.
Thank you.
If you guys have questions, please let us know. We'd be happy to answer them. Please share this with somebody that is having problems or in pain and they don't know what to do with it. We'd be happy to take a look. And that's it. Have a great day. We hope to see you soon.